I know that unaweza send resume. Amekumbuka password.
Haiko sawa, kila kitu wewe tuendelee.
Sawa. Okay.
Good evening, everyone. Welcome to this health and fitness section. My name is Dr. Omari. I'm a physician and diabetologist. I practice at ScanLab Clinic. It's a specialty clinic based here in Nakuru. But today I'm wearing a different hat. Today we're here to talk about cervical cancer awareness because it's Cervical Cancer Month. So the theme for the discussion today was cervical cancer awareness and the steps towards diagnosis of cervical cancer and screening. So I thought it was important that at least we increase the awareness out there in the community so that we can have more patients coming out earlier for screening rather than the scenario of patients coming in late and we make a late diagnosis. So cervical cancer in Kenya is still one of the top most leading causes of death amongst women in the field of oncology or cancer diseases. And it's not only in Kenya, unfortunately, this is a worldwide data. This is a preventable condition. So cervical cancer is a preventable type of cancer. So when we say screening, what exactly do we mean? So screening means we are able to diagnose the condition before you feel it. So you can be very normal, walking around, going about life as normal, and yet this condition has started to manifest. So how can you be able to be screened for cervical cancer? So the screening modalities or methods available out there, one, include what we call a pap smear. So a pap smear is a test, let me call it that, which involves checking the cells of the cervix to find out if, one, they are normal, or they have already started undergoing changes that could indicate that a cancer is beginning to develop, or three, the cells are cancerous already. It's a very simple test, though maybe not very comfortable, because it involves getting the cells being brushed from the cervix using a small brush. These cells are placed on a plastic plate and they are processed, and within a few days a report comes. So the report can either come back as normal or that there are precancerous cells, so they are seeing cells that are already abnormal but they are not yet at the cancerous stage, or they are already seeing cancerous cells. So that's one of the first modalities for screening for cervical cancer. A pap smear is very readily available. This is a test that you can walk into most hospitals and institutions and request for it to be done. So apart from a pap smear, now things have been made a bit easier. Cervical cancer is driven by a virus which we call HPV, human papilloma virus. So instead of doing a pap smear where cells are brushed from the cervix to check if there are any precancerous or cancerous cells, the other option could be doing a HPV kit. I mean, getting a kit and having tested and be tested for HPV. So these kits are available now. The kits can actually be administered at home. It can be a self-administration kit, and then you take the sample as you have been requested and take it to the hospital. The HPV kit is costs a bit more than the pap smear. A pap smear is actually one of the most affordable tests. So when the result comes back normal, then your healthcare provider will request you to be coming back and having the pap smear repeated after a certain duration of time. So they may give you a turnaround time of maybe two years or 3 years and request you to come back again. Now, there are people who may have their reports reading as pre-cancerous or they are already beginning to see cancerous cells in the cervix. So what happens then? So the doctor will ask for a more thorough examination of the cervix. So the cervix is literally the entrance into the womb or the uterus. So the next examination may have to be done maybe in a hospital, and the patient may need to be given medication so that, you know, they are much more comfortable and relaxed. And I know sometimes this can even be done in a theater kind of setting. So what happens then is there is proper evaluation of this entrance of the womb. How exactly does it appear? And then another sample is taken. Now this sample, any areas that look abnormal, then a bigger sample is taken, not necessarily that they're cutting something big, but they're taking a sample that is big enough that can be able to give a conclusive report as to whether cervical cancer is present or not. So that is what's called colposcopy. It has a bit of a difficult term, it's a mouthful, colposcopy. And then the sample taking is what is called a punch biopsy. So if a punch biopsy or colposcopy is not done, then examination can still be done, and then a sample with a spoon-like instrument sweeps through the cervix, which is the entrance of the womb, and scrapes off some tissue for further testing to confirm whether, again, a patient has cervical cancer. So these are basically the steps that patients who are asymptomatic, that means they are normal, they don't have any symptoms, they may need to undergo for them to know whether or not that, you know, cervical cancer is beginning to appear. For patients who have been diagnosed with cervical cancer, then what happens next? They require what is called staging. So staging helps to understand the extent of the condition. How far has it spread? Is it still just in the entrance of the cervix, or could it have gone to other nearby organs? So their imaging now is required. So pictures are taken. Your patient might have to undergo pictures like a CT scan or pictures like an MRI that look at the tissues and can tell how far the disease has gone. Is it affecting the nearby organs, or has it gone to further organs? So all of this information is required and necessary before any treatment options are discussed, or what is the plan of managing this condition. So for those who have already undergone staging, then the next plan is usually to see whether is this a condition that can be surgically corrected. Can a patient undergo surgery, or can a patient undergo treatment options like radiation, that is radiotherapy, or can a patient undergo treatment options like chemotherapy? Okay, so those will depend on the extent of the condition and how well the patient is physically. Are they strong? Do they have other conditions that maybe have made them less tolerable to medications? Do they have good kidney function, good heart function, good liver function? Because all of this, you know, as much as a person is treating a cancer somewhere, it's the whole patient who's receiving treatment. Okay, so those are generally the steps that that we see patients through when we're talking about both screening and making a diagnosis and staging and planning them for treatment. So there are some patients, unfortunately, who come and they're already having symptoms. So what are these types of symptoms that we see that we get worried for possible cervical cancer? So we see patients coming in and they're having bleeding or spotting, and it's outside, for example, their menstrual cycle. And others are reporting persistent discharge, and this discharge is discharged through the birth canal. Sometimes it is has a blood smell. We see patients who are coming in with problems like they're having pain or discomfort when they're having intercourse with or sexual intercourse with their partners. We're having patients who are coming in with difficulty in passing urine because the passage in which they're able to pass the urine through, the condition has already spread and caused problems there. we're having patients who are coming in with general body, unwellness. They're losing weight, they're becoming anemic, and especially the bleeding, that is beyond their period, and also for women, for example, who have already achieved menopause and they start having vaginal bleeding. That definitely is a cause for alarm. So it's important that even though health around the reproductive organs is not something that people really talk about much, but it is important that if, for example, you have family or people, and they're mentioning that they're having some of these things, the most important thing is they need to get into hospital and get evaluated. I always say that a stitch in time really does save 9. Yeah. So I don't know how much time I have spent and how much time I have, but I will be free to welcome any questions concerning some of the things that I have talked about. I know some of them are medical terms that may be a bit tricky to elaborate, but I'll give it my best in terms of trying to explain. Thank you. Any questions? ScanLab Clinic. My name is Dr. Omari. I'm a physician by training, but today our topic was about cervical cancer awareness because this is Cervical Cancer Month, and we felt that it's important to highlight the key issues that come across, especially when we're talking about cervical cancer screening and diagnosis. So I get a lot of questions that ask if these are tests that can be done in Nakuru. Yes, these are tests that can be done in Nakuru. A pap smear can be done in Nakuru. It can be done in very many facilities, including here at ScanLab. For anybody who is interested in having a pap smear done, you can visit any of the ScanLab branches. We have an office, a diagnostic office based at Polo Center on ground floor. We also have the laboratory aspect at D&D building on 5th floor, and at the clinic, which is at D&D building on 1st floor. So any inquiries you may have about having a pap smear done, you can come and we can organize for that to be done for you. For people who might not feel very comfortable having a pap smear done, there is also the HPV DNA kit that's available, and that patient can also have that access. They can access that particular service. So the other tests that we talked about when the results are abnormal, like a precancerous result or a cancerous result, that may require the gynecologist, who is a specialist at, these are specialists who usually manage these kinds of conditions, can be able to organize for the patient to get the colposcopy and curettage and get a sample which can be able to confirm whether what was seen on the pap smear is actually the situation on the ground. For further tests like the imaging, where the patient requires to have a CT scan, where the patient requires to have an MRI, then those facilities are still available at ScanLab, at the diagnostic center. We have lots of radiology services, and a patient can be able to access both MRI services and CT scans. The other evaluations like assessing kidney function, assessing liver function, finding out the blood level, those are also services that a patient can access. So I think the other question I also usually receive is, how does a person lower their risk of getting cervical cancer? So I remember one of the nurses said something like, cervical cancer is a sexually acquired disease because the virus that causes the changes that eventually become cancerous is HPV. So any person who is already sexually active can be screened for HPV, and that is the reason why there was vaccination programs for teens and preteens below the age of 10, or people who are not sexually active, especially the girls, so that we prevent them from getting HPV in the future. So that's something we know we can do for our young girls to protect them from getting HPV. The other common question I think that I also see is, once a patient already has, for example, confirmed, cervical cancer, how do they go about their treatment? Because as you can see, the treatment options are quite involving. We really encourage patients to, when they are diagnosed, please get a support system. A cancer diagnosis is not something that's easy for a person to bear by themselves. It's a diagnosis that makes a person change how they view their future. And if you're able to get a support system, whether it's within family or whether it is within other patients who are walking the same journey with you, it really makes a big difference. Because sometimes you may have, difficult times. There are days that are difficult. There are days that you feel sick, you get radiotherapy, you get chemotherapy, it makes you feel sick, and it helps when you get good support. It's not the kind of journey that you really want to walk alone. So support groups are there here within the county. Our government hospital at PGH has a very active support system for our patients, and our patients, even with NHIF, are able to access good services, and they're able to improve the quality of life even without necessarily having to go to other bigger towns like Nairobi or Kisumu or Mombasa to access the services. Even if they required radiotherapy, that is still available within the county. Treatments do have their own complications. I also always get to hear that now. If they start treatment, won't I feel worse? Won't my disease even get worse? That's not true. Most of the time, the treatment is individualized. So the reason why the staging is done to see the extent of the disease, the reason why somebody wants to find out how your general health is so that the treatment is tailored towards you as an individual, getting the best of what you can from what the plan is. So that one person's treatment may not necessarily be the same as another, but it is important that the patient also commits to stick to their treatment plan. Hydration, of course, is important, especially if they're getting any chemotherapy and radiotherapy. Monitoring of the kidney function is important, and you may find that is requested quite often. Pictures probably to see whether the kidneys are working well or if there's any blockage towards how the urine and is flowing from the kidneys out is also something that might be monitored quite often, because we do see that as one of the late complications sometimes of cervical cancer. So I think in summary, I would say, again, just to emphasize that cervical cancer is preventable. And yet, when we look at our statistics, it's still amongst the highest in terms of occurrence in women. So it means there's much more we can do in terms of creating awareness. It's a cancer that it grows very slowly. So most patients have had it for quite some time before they come in. And it's a cancer that can be identified early using a very simple test, which might not cost much, but it might actually save a life. So let's advocate for more screening. Let's advocate for screening amongst our sisters. Let's advocate for screening amongst our elderly, relatives, your aunts, your shoshos, okay? Let's the men who listen advocate for screening amongst their wives, their girlfriends, their sisters, okay? Because you may never know that one thing that you said might actually make a big difference for your family. Yeah. For those, yes, who do have the condition, we do our very best to ensure that we can give the best treatment that we can. Once again, thank you so much for listening to me, and have a good evening. Yeah. Any other questions or concerns? Couple of questions here, apart from the ones that we have addressed. So one of the questions was, this is a question by Nakuru Fitness Week. Let me see. So, sorry, it's a question by Del Kuya. So he asks, given HPV is incurable, if one already has the virus, even with medication, are they at risk of getting cervical cancer? So HPV, yes, is a virus that typically will hide. It might not necessarily make you sick, but it's still in the background causing changes within the cervix. So yes, even with medication, you still, the person who has HPV does not completely eradicate the virus, and they are still at risk of developing cervical cancer. The next question, I think somebody asked, Jerry Njogu asked, how much do you charge for testing cervical cancer? So the tests, the different tests have different costs. A pap smear is far much more affordable. I've seen the prices range from between 1,000 all the way up to 2,000, but in some facilities, like at the provincial hospital, I think it might even not be charged at all. So the HPV DNA kit might cost a couple of thousands, but feel free to contact the Facebook page for ScanLab, and I think they can give you the exact amount if you want to have whichever test you prefer for cervical cancer screening. So the other questions, in case of a couple, if a man is not vaccinated against HPV, however the woman is the woman still at risk, or does her immunization guarantee protection? So the immunization guarantees protection to a great extent, okay? So that even if the man is not vaccinated, actually the vaccination program is for women and girls, people who are not yet sexually active. So the vaccination does not target men, okay? Let me see, I think so far those are the questions. Other comments I can see here. I can see somebody asked a question, though it might not necessarily be related to the topic for the day. Munira Ibrahim was asking, what can one use to balance hormones? So I would probably say the context of the question might be a patient probably who's having hormonal imbalance, but hormonal imbalance does not actually contribute in any way to cervical cancer. Hormonal imbalance can occur because of various reasons. Sometimes, mostly we see it when a person is overweight or obese. Sometimes even as women are growing and maturing, you know, the adolescents and teens might not properly have balanced their hormones to ensure that they have a regular menstrual period. But a lot of times for people who are experiencing hormonal imbalance, especially when it comes to their menstrual cycle, the gynecologists typically will use hormonal medication to try and regulate, and that means, you know, to try and ensure that the menstrual cycle becomes more predictable. And in that way, after a couple of cycles, then they may be stopped and see whether that has assisted. But otherwise, apart from the hormones that are present in the reproductive system, we do have other hormones that may make the menstrual cycle not regular. Like, for example, a person who has a thyroid problem may make their menstrual cycle not appear regular, or a person who has very poor eating habits. So patients who are eating very poorly, we do see a lot of young girls now who don't want to gain weight, so they're eating very little. That also causes them to become, to lack a regular menstrual cycle. But again, as I've mentioned, people who overeat then, or gain a lot of weight, or are eating in an unhealthy manner, then they also, the menstrual cycle can become irregular. I think that would probably conclude it. Thank you for the comments. I see somebody mentioned it's a very informative session. Thank you, Patrick Kenyua. And we also thank the Nakuru Fitness Week for organizing the session.
Good evening. My name is Brian Lusisa. I am a nurse at ScanLab Clinic. We are going to be diving into the world of spirometry. So let's take a breath of fresh air and begin. Spirometry is a lung function test which is going to help us transform how we understand and how we manage respiratory conditions. It is a valuable tool in providing insight on how our lungs are functioning. We are going to take it out in 3 angles. Firstly, we are going to define what spirometry is. Secondly, we are going to see why it is crucial to have spirometry done. And thirdly, we are going to see who can benefit from having spirometry done. So, number 1, spirometry is a painless, non-invasive test which measures how much air we breathe in, how much air we breathe out, along with how quickly we breathe out. It also provides a valuable insight on how our lungs function and helps in early detection of respiratory issues. Secondly, we are going to look at why it is important to have spirometry done. The first importance is that it allows early detection of respiratory conditions, which is going to enable our health providers to provide timely and efficient management to respiratory diseases. Number 2, it is important because of disease monitoring. People who are already diagnosed with respiratory conditions can benefit from spirometry because it's going to help us monitor how the disease is progressing and also how efficacious the treatment is. Number 3 is for proactive health. For individuals who would like to be a step ahead with their respiratory health, it is going to be prudent that you do a spirometry test for the same. Our third angle is who is going to benefit from spirometry. And the first group of people who are going to benefit from spirometry are the individuals at risk. Some of the examples of the individuals at risk are people who smoke, people who have a family history of chronic respiratory conditions, and people who are exposed to occupational hazards. The other group of people who might benefit from having spirometry done is people who we are managing for chronic diseases like pneumonia, like asthma, like interstitial disease. It can help us to gain valuable insight on how to treat or change medication. The third group of people who are going to benefit from doing spirometry are people who want to prevent respiratory diseases because spirometry will give us a quick and an early idea of any symptoms or any signs of respiratory issues that might be cropping up. In closing, we would like to thank you and welcome you to ScanLab Center to do a spirometry test. As we know, breathing is fundamental to life, and spirometry is the key to ensure that we have a strong and steady breath. So feel free to visit us and have spirometry done. Thank you. Have a brief demonstration for the benefit of guys who are seeing this for the first time. So basically, as we said, it's a non-invasive test which just involves breathing in and breathing out. So when you come for the test, we'll have you to get relaxed, and then we are going to start the test. So we have a sterile tool used for breathing. You can just take that out. Yes, fix it here. So every client who comes will get a sterile breathable mechanism. So what we are going to do is we ask the patient to take a deep breath in and then take a deep breath out. And we usually do it 4 or 5 times so that we can get different parameters. This is going to allow us to see the different rates of how the client is going to be exhaling. So quickly, we are just going to move on. So I'll just ask you to take a breath, deep breath first. Okay, put the mechanism in your mouth and blow. Blow, 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 blow. Good. You can relax now. Breathe in, breathe out for a bit. Okay, second time, breathe in. Breathe out. Blow, 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 blow until you feel that there's no more air coming out. Okay, lastly, we do another breath. Breathe in. And then we breathe out. Breathe out, breathe out, breathe out, breathe out. Thank you. So that is what entails when we say that we are going to do spirometry. It is short, it is painless, and it is non-invasive.